Good afternoon, and thank you for joining us. We are now presenting a recorded message from Governor Tom Wolf. He could not join us live today because of the satellite conditions which have been affected by the wind.
Thank you all for joining me today, and I want to thank everyone for your diligent efforts to remain informed about the spread of COVID-19 and for your continuing to do your part in helping stop this deadly virus. So many different facets of our community. I am incredibly proud of what we've accomplished together so far. By working together with the single-minded goal of defeating COVID-19, we have prevented the huge spikes in cases that we've seen in other places. But I just want to emphasize that we're not yet done. If we begin to slip in our efforts to distance ourselves socially, we could very easily see explosive growth rates. There are cases where just one person has infected dozens of others. So don't be patient zero. Stay home unless you absolutely must leave. Right now, more than 2,000 people are hospitalized in Pennsylvania with COVID-19. We expect that number will continue to increase in the coming days. For the past few weeks, medical facilities have been shifting resources internally. They want, as well we all do, to ensure that their facilities are ready to save lives while also protecting their. Some of these efforts are in preparation for a surge in COVID-19 patients, including moving additional staff to emergency rooms, purchasing additional equipment, and setting up more beds. All of these efforts come at a cost. Meanwhile, hospitals are working to prevent the spread of COVID-19 by eliminating elective surgeries, preventive medicine, and other non-urgent care. This means that many hospitals have had a significant decline in revenue. The combination of increased costs and reduced revenue has hurt many hospitals financially. We cannot allow any of our hospitals to become bankrupt. When this pandemic finally ends, we're going to need our hospitals to care for our regular medical needs like heart attacks and broken bones. So today, I'm announcing the Hospital Emergency Loan Program. This is a $450 million low-interest loan package that will provide immediate working capital that will allow our medical facilities to get the personal equipment and the personal protective equipment they need. The Hospital Emergency Loan Program will help ensure every hospital can afford to get equipment essential to fighting this war without facing financial ruin. And when we return to a more normal state, our hospitals will see their cash flows increase, allowing them to better shoulder the financial burden of COVID-19. The Emergency Loan Program will allow us to fully mobilize our health system right now. So we 2019 novel coronavirus. It will allow us to continue to care for all hospitalized patients, and we can keep our frontline medical staff safer and healthier. We owe it to these workers to do everything we can to support them right now, from the doctors and nurses directly caring for COVID-19 patients to the maintenance staff cleaning our hospitals and keeping the equipment running, to everyone in between. You are our heroes right now. So once again, I'm calling on everyone to thank these workers by taking the one action that will help them the most: staying home. If we all work together to stop the spread of this virus, we can reduce the human and the financial toll on our medical facilities, and that's going to help each and every one of us in the long run. So make the decision to step up and stay in. Thank you.
Good afternoon again. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 1,751 new cases of COVID-19. This brings our statewide total to 19,979 Pennsylvanians who have tested positive for COVID-19 in all 67 counties of Pennsylvania. Approximately 955 healthcare workers. Approximately 1,209 of our total cases are in 181 long-term care living facilities, which includes nursing homes and personal care facilities. Tragically, we have now had 416 deaths among those who have tested positive for COVID-19. To date, all of those that have tested positive are adults. As of noon today, hospitals are reporting that approximately 2,069 patients are currently hospitalized due to COVID-19. This is about 11% of our total case count. 598 of those patients that are hospitalized are on ventilators or breathing machines. Across our healthcare system, approximately 45% of hospital beds, 38% of intensive care unit beds, and nearly 70% of our ventilators are still available. In preparation for the potential surge on our healthcare system, we continue to supply our hospitals, long-term care living facilities, emergency management services, and county emergency and health agencies with personal protective equipment. As of today, we have supplied 1.8 million N95 masks, 136,000 hospital gowns, 912,000 procedure or hospital masks, 730,000 pairs of gloves, 990 goggles, and 147,000 face shields. We are still working on acquiring additional materials from federal stockpiles and many other sources in Pennsylvania and in the country. We recommend that individuals and companies that might be able to sell us those materials or maybe manufacture those materials source the portal that Governor Wolf set up through the Department of Community and Economic Development. We know that more will be needed from our healthcare system, which has done so much already, and we thank them. We would like to thank everyone in the healthcare system, in our hospitals, in our health systems, nursing homes, personal care homes, EMS workers, really everyone so much for their courageous work. The best way that we can support them is to stay calm, to stay home, and to stay safe. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time that it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Please don't touch your face, especially after touching surfaces, and clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask, because you might come in contact with others. And remember, my mask protects you, your mask protects me. These everyday prevention measures can help slow the spread of the dangerous virus, COVID-19, and also give to our families, our communities, and our Commonwealth that we will recover together. If you have questions about your health, please contact your health care provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. From Capitol Wire and Lehigh Valley Live, questions about the swings in number of death reporting. For the third day out of the last 4 days, the number of deaths has increased by 70 or more. Tuesday's jump was explained as due to a lag from the weekend, but with Tuesday and today, are we beginning to see a ramp up in the deaths of individuals who have been battling this virus for several days or weeks and may have been on ventilators and now passing?
I think that is correct. I think that we are seeing an increase in the number of deaths of these patients who have been ill for a while now and finally, tragically, have succumbed to COVID-19.
USA Today, how is Pennsylvania collecting information on the number of nursing homes with COVID-19 cases and the number of residents who have tested positive? What challenges is the state facing in collecting real-time data? And is Pennsylvania planning to release a list of nursing homes with positive cases?
So we are not planning to release a list of positive cases, but we are watching that data very, very closely. Nursing homes, personal care homes, etc., use our data system to report cases and, tragically, to report deaths if they occur. And we have the usual challenges collecting data, but not extra challenges. And we're very, very confident in our data.
From the Pocono Record, some families of patients in nursing homes are concerned that their family members may not be receiving proper treatment, such as transfer to a hospital, even when exhibiting symptoms of COVID-19. Are there protocols in place for this? And as a follow-up, if not, are there plans to address it?
So there are definitely protocols for the treatment of individuals in nursing homes and other long-term care living facilities. We have our own standards that we have put out, as well as the Department of Human Services for personal care homes, and there are standards through the Centers for Medicare and Medicaid Services. We actually have an anonymous complaint line where people who have any concerns about nursing homes can contact us about their concerns, and then we will address them.
From WNEP, several health systems in Northeast and Central PA are using hydroxychloroquine to treat coronavirus. Does the Department of Health support that?
Well, so there are actually now established clinical trials by the National Institute of Health for testing hydroxychloroquine and whether it can be useful in treating COVID-19. And of course, our excellent intensive care physicians are using different types of investigational protocols in very, very sick patients, and we support that use. But all of these potential treatments have to be tested and then proven before they become a standard of care for treatment of patients with COVID-19.
From PBS 39, would you describe Governor Wolf's order to commandeer equipment if necessary as a last resort, and why is that necessary?
Well, so there are mutual aid agreements. There's a statewide mutual aid agreement through the Hospital Association and hospitals and the Department of Health. But we wanted to make extra sure that if there were resources that are needed by any hospital or health system or long-term care living facility, that we could move assets according to what is necessary. And so the governor and the administration felt that it was necessary to issue the executive order.
From WLVR News, in regards to PPE, we've heard a lot about efforts to get masks to hospitals. We're hearing gloves are running low on supplies, and in some areas they're worried that they may not have enough to get through the pandemic. What's the state's reserves for gloves, and is there a plan to get more?
So I don't have that number at my fingertips, but we do have reserves of gloves. We have been pushing out hundreds of thousands of gloves, as I mentioned, over the course of this pandemic, and we continue to get new resources. Continue to push that out to hospitals, health systems, nursing homes, etc.
From WESA, the number of deaths in Allegheny County has nearly doubled in the last 2 days, from 10 to 18. Is there some epidemiological or virological explanation for this? And is this jump expected or concerning in any way?
Well, we do expect, tragically, more deaths from COVID-19. The biggest rise in cases and in deaths we're seeing in the southeast, so Philadelphia and the Collier counties, and also northeastern Pennsylvania. But certainly there are cases of COVID-19 in Allegheny County. in contact with our communities on a regular basis, and especially our county health officials and community health officials. So, for instance, I spoke with Bogan of Alabama.
Gathering case and death information in counties.
So physicians, hospitals, nursing homes will report any deaths into our information system, our data system, and then we collect all that data and then put out a number and set the limit at 12 midnight, and then we put out that number with our information to you the next day.
As a follow-up to that, in Westmoreland County, there seems to be a lag time in the reporting of the information. Why is it different than the state's reporting, and how important is it to have the latest information? Well,
we do feel our data is accurate, but again, we collect all the information for a day at 12 midnight. And that's the data that we report out the next day. If a county has a different schedule of reporting, so if someone tragically passed away at 3 or 4 in the morning and they report that at 9 or 10, then the data will be somewhat discordant. But overall, actually, our county and state data are consistent.
From WNEP, regarding the stay-at-home order, a viewer asks, is it okay to drive to a state park or other walking trail in order to exercise? Would that be considered essential travel?
Well, for the most part, we really want people to stay home, and we wouldn't consider traveling a long distance to a state park essential travel. But if someone is doing some type of activity like hiking and they're by themselves and solitary, then that would not transmit COVID-19. But what we worry about is that on the way to that state park, maybe the person needs gas, maybe the person needs to use the restroom or get something to eat, and that is activities that can then transmit COVID-19. So we really want people to stay home. If they do go out, please wear a mask.
From WFMZ, many local townships, police, fire, and first responders are holding vehicle parades to cheer shut-in residents. Is this a violation of the governor's shelter-at-home order? Some of the viewers perceive it as a double standard and want to know if there's any harm in these well-intentioned events.
Well, I think what I'd like to emphasize is that the mitigation efforts that the governor has put in place, these prevention efforts, are absolutely critical to continuing to bend the curve in the terms of the number of new cases and prevent our health system from being overwhelmed. We have been doing a really good job at that, and we think that Pennsylvanians will do the right thing, and the right thing is to stay home.
From NBC News, it's been suggested that Philadelphia may be the next coronavirus hotspot. Do you agree, and what kind of preventative measures did the state put in place to help you flatten the curve?
So as I've been mentioning, I mean, we have worked very closely with the city of Philadelphia and the county, as well as the collar counties of Philadelphia, the suburban counties, on these mitigation efforts. That includes the closure of schools now till the end of the year. This includes the closure of non-essential, non-life-sustaining businesses, and then the stay-at-home order, which actually started in Philadelphia and the collar counties as well as Allegheny County weeks ago. And so all of those measures have been put into place in collaboration with the city of Philadelphia and the other counties, again, to help prevent the spread of COVID-19. We have encouraged extensive laboratory testing. There has been a mass drive-through testing in Philadelphia as well as in Montgomery County. The one in Montgomery County will actually be able to continue. Philadelphia has other plans in terms of making sure testing is available. And then we've been working tirelessly to buttress the hospitals and health systems to make sure they can deal with that rise. We do expect that cases will increase in Philadelphia, and unfortunately deaths will increase, but we have been able, with all of those measures, to bend the curve so that it is manageable by our hospitals.
In regards to bending the curve, Secretary, from WGAL and News Talk 104.1, Are you referring to the percentage of increase in new cases declining each day when you're referring to bending the curve?
So I am talking about, yes, the percentage in terms of the increase of new cases, that has not followed that exponential rise that we had talked about. It has followed a more linear curve, so it has been going up, but it has not been going up as rapidly, and all of that is in our favor, and will indicate that as the surge comes and passes, our healthcare system will be able to cope.
Along those lines, News Talk 104.1 and Lehigh Valley Live have questions about the peak. It's been reported that this week and next would be the peak of cases and deaths in Pennsylvania. And when we anticipate it, do you think it will vary by region?
So, there isn't going to be one peak, and it's not going to be the same in each area. There will be variations according to region. We have been looking at many different models. And yes, the model from the University of Washington indicates that this surge will be starting and then be peaking certainly in certain areas by potentially next week. But as Dr. Fauci has said, the virus determines the timeline. We don't determine the timeline. And we're going to be watching all of our statistics really carefully, especially over the next number of weeks.
From the Philadelphia Inquirer, New Jersey has ordered its residents to wear masks when they're at the store. Is Pennsylvania considering going beyond its mask recommendation and making it a mandate?
Well, Governor Wolf and I really have trust in Pennsylvanians, and we feel that Pennsylvanians will do the right thing. The right thing is for people to stay home, but if they have to go out for life-sustaining activities, to go get food or to get medication, that they will wear a mask.
Along those lines, the Inquirer follows up with what are some of the orders and recommendations you're seeing the worst compliance with or the most concerned about?
Well, I think that we're really depending upon Pennsylvanians to do the right thing, to stay home, to wear a mask if they go out. And then we want to emphasize all the measures that I talk about in my daily reminders in terms of washing hands, not touching your face, cleaning surfaces.
From the Daily Press, some of the north central Pennsylvania counties continue to report only 1 or 2 cases of COVID-19. Do you think there are only some isolated cases of disease in these areas, or are they likely many more people that are going undiagnosed?
Mm-hmm. Well, we know that there is widespread community transmission of COVID-19 throughout Pennsylvania, and we're really only able to test those that are symptomatic, those that have symptoms of COVID-19. We know that our data is an underreport. I've talked about this before. Just like with the flu, we know that the true caseload of COVID-19 in Pennsylvania is much higher. And so even though only a few people have tested positive in rural counties, we expect that there are more cases. But of course, we do usually expect less transmission in those areas because they have less population density. The most population-dense city in Pennsylvania is, of course, Philadelphia. And then next would be Pittsburgh. Others would be some of the densely populated suburban counties of both those cities. Of course, rural areas have much less population density. But rural areas aren't off the hook. We're concerned that if there is an outbreak of COVID-19 in a rural area, that it could spread quickly and pose a public health threat.
From WNEP, if people had some of the symptoms of coronavirus back in February, could they have had COVID-19 and not known it?
Possibly, although, be honest with you, especially earlier in February, if you had symptoms of fever and cough and other symptoms, probably be more likely that you had influenza than COVID-19. What we're hoping for as time progresses over the next number of months is that we'll have the ability to do serology testing. That's a blood test that tests your immune response, and then we'll be able to see who's immune to COVID-19.
From News Talk 104.1, our audience is asking if there are numbers of recovered COVID-19 cases in Pennsylvania. If so, how many? Can you recap your answer for that, please?
Sure. So we are looking in a number of different ways to look at hospital discharge rates with COVID-19. But in terms of generally patients who have recovered, particularly patients who have had symptoms, they were not severe, they stayed at home, they rested, they recovered, we're not able to track that. Again, we might be able to get more data on that as we're able to do more significant serology blood testing testing to test the immune response, but we are not able to track the many people who have recovered in their communities.
From Lehigh Valley Live, does the hospital loan program also apply to Easton Hospital, and what is the status of those talks?
So I would leave it actually to the governor's office in terms of the specifics about Easton Hospital. I know that there was the ability to loan money to them, and so I actually don't know those specifics.
From WTAE, do employees and residents of large CCRCs like St. Barnabas have the right to know what area of the complex that a confirmed COVID patient worked or lived in, like maintenance, administration, healthcare, independent living? A viewer would like to know.
I know that if a personal care home or other residential facility has a positive, they do let people know. They don't usually go into specifics about who that might be because of patient confidentiality and privacy.
From the Tribune Review, is the state keeping track of the number of coronavirus tests being administered in each county, and would you consider making that breakdown available?
So we do know overall the number of tests that are available. We know how many positives there are, and we know how many negatives there are. We have not been releasing that by county, but we can consider it.
And then from the Pittsburgh Business Times, can you provide more information about the hospital emergency loan program that the governor announced? When will the funding be available?
I don't have those specifics, but I'm sure that will be released given the governor's recent announcement.
Thank you, Secretary. That concludes our briefing for today. Tomorrow's briefing will be on Saturday at noon, so you can please tune in live then. Thank you so much.